So a lot of fist pounding over the last 7 years, Republicans threatening to repeal this and put in something else. And after years and years, finally just last week, they put their own plan on the table here. Your view of, is it even politically possible to repeal this? And then what do you think of the Republican plan?
It's not politically possible to repeal the Affordable Care Act. There are 20 million people who've got coverage. Every insurance company has built its model on the Affordable Care Act. Every health system has built its model on the Affordable Care Act. Every drug company has built its model on the Affordable Care Act. It's not being repealed. I spent a number of hours reading the Republican plan. I would say that I found one good idea in there. I'm not joking. There was an idea.
What was it?
They want to, so for those of you who aren't into the arcane aspects of Medicare, there's Part A, which pays for hospitals, Part B, which pays to doctors. They've been separate since the creation. No insurance company runs that way. They suggest merging them with one set of deductibles, one set of co-payments and co-insurance. And that is an idea that I think we do have to go forward with. I would say the rest of it, my overall general assessment is it is not a coherent plan in the sense that it has a big idea and a big structure that all fits together. It's a lot of ideas that have been floating around in the Republican world that are, in general, been discredited, and I'll give you two particulars. So they recommend increasing the Medicare eligibility age from 65 to 67. That's 5.4 million people they're going to take Medicare away from. Okay? So then you ask yourself, all right, what's the substitute? Because these people need insurance. They're just at the point where they're beginning to get chronic illness, et cetera. You're not simply going to throw them off Medicare. So you've got really three options. One, they go on to Medicaid if they're relatively poor, right? States pay some of that cost. Federal government pays that cost. You're not saving a whole lot of dough there. Two, they go into the exchanges. They get a subsidy to buy insurance in the exchanges. Oops, Republicans are getting rid of the exchanges, so that's not an option. Third, they go on to private. If they're still working, they get their employer to pay the bill. Or, of course, fourth, they get uninsured. Now, the estimates have been, of these 5.4 million people, between 400,000 and 1 million, depending upon what the infrastructure is, lose health insurance at 65 to 67. Employers are not going to be so keen about hiring them because they are higher cost. And you switch them to Medicaid. So you've got to call it 500,000, 1 million people uninsured who used to get Medicare. And how much are you saving? 0.2% of government spending, federal government spending on health care. Not a really smart deal. They also want to get rid of the mandate in the exchanges. They're against the mandate. Well, what about people who have pre-existing conditions? The most popular part of the Affordable Care Act has been, you got cancer, right? You've got inflammatory bowel disease. You've got some horrible thing. And either you lose your job or something happens and you don't have insurance. You can't be discriminated against. They can't deny you coverage or they can't give you coverage at an exorbitant premium. The American public likes this provision a lot. So what are the Republicans? What's their proposal if we're getting rid of a mandate and getting rid of the exchanges? We're going to have what's called high-risk pools. We're going to take all these very sick people and concentrate them in a product and then sell it to insurance companies. Well, let me tell you, what insurance company likes that? Only sick people. You can insure only sick people. Crazy idea. So what's it going to cost the Republicans to do that? $25 billion. And we know those high-risk insurance pools are terrible. We tried them early to bridge between the passage of the Affordable Care Act and when we opened the exchanges. And as one of my Democratic colleagues who worked on the Affordable Care Act said to me, they were one of our worst ideas. They just don't work. So they don't have a coherent plan. And everything they've tried, I think, has huge, huge downsides. It's either very costly for not covering a lot of people or increasing the eligibility for Medicare throws people off insurance and doesn't save a whole lot of dough for that valiant endeavor. I think it's going nowhere, absolutely nowhere. It's not a coherent replacement policy at all.
Tell us what you really think.
I said there was one good thing in it. I said there was one good thing in it.